Hi, you guys. Welcome back for our daily practice question. It is day 37. And as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, digital flashcards, Q banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 65-year-old male presents with shortness of breath, fatigue, and chest pain during exertion. On examination, you notice a systolic murmur best heard at the second intercostal space with radiation to the neck. The patient has a history of hypertension and hyperlipidemia. Which of the following is the most likely diagnosis? Is it A, aortic regurgitation, B, mitral stenosis, C, aortic stenosis, or D, mitral regurgitation? Take a moment and tell me what you got in the comments, y'all. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked, right? So here the stem of the question states, which of the following is the most likely diagnosis? And y'all know what I tell you. If they're asking for a diagnosis, you need to run it back and look at the assessment findings. And when you are looking at those assessment findings, I always say to pay attention to three factors if they are provided: the age, the gender, and their ethnicity, okay? And I say this because those three details can help you when determining certain diagnoses as well as treatment options. Okay. So here it lets us know this is a 65-year-old male presenting with shortness of breath, fatigue, and chest pain during exertion. On exam, it's noted that there's a systolic murmur best heard at the second intercostal space with radiation to the neck. So here, okay, we're diagnosing a murmur, right? So, if you have done any of my review courses or listened to my Murmur videos, I always tell y'all, if you're answering Murmur questions, I want you to make sure that you pull out two details every time. Determine whether they are telling you is systolic or diastolic, and determine where the location is. If you can pull these things, you can get the question right every time, okay? So here, it lets us know this is a systolic murmur. So Brittany's brilliance. I call it my sassy systolic. I have revamped it, but I say men really are silly, right? Men really being MR, mitral regurgitation, are silly, AS, aortic stenosis. And then you can also have MVP, but let's just stick with this. And an additional side note is that systolic murmurs are the only one that radiate. Here they said it radiates to the neck. But we're going to keep in mind that this can be mitral regurgitation or aortic stenosis, right? Now, we're going to move to the location. It says at the second intercostal space. Is it aortic or mitral at the second intercostal space? It's aortic, right? A comes before M in the alphabet. Aortic is at the second intercostal space. Mitral is at the fifth intercostal space, right? So that's why I say A comes before M in the alphabet. A is at the second for aortic. M is at the fifth intercostal for mitral. So we know this has to be aortic stenosis because it's the aortic location, and aortic stenosis is the systolic style murmur, okay? So C is your best answer. Also to confirm, it states that it radiates to the neck. Your aortic murmurs radiate to the neck. The mitral radiate to the axilla, okay? Question number 2. A 45-year-old woman presents with fatigue, palpitations, and recently recovering from strep throat. On exam, you hear a diastolic murmur, best heard at the apex. What is the most likely diagnosis? Is it A, aortic stenosis, B, aortic regurgitation, C, mitral stenosis, or D, mitral regurgitation? Take a moment and tell me what you got in the comments, y'all. All right, so stem of the question, what is the most likely diagnosis, right? All right, same thing. Run it back. Look at those assessment findings. So we had a 45-year-old woman that comes in. She has fatigue, palpitation. She just recently recovered from strep throat. On exam, you hear a diastolic murmur, best heard at the apex. So again, is it diastolic or systolic, right? That's the first thing we're looking for. And it says diastolic. Remember my sassy systolic mnemonic says men really are silly and diastolic are the opposite, right? So if systolic is men really being mitral regurg, that means diastolic is mitral stenosis, right? If systolic is aortic stenosis, then diastolic is aortic regurgitation. So we know it has to either be mitral stenosis or aortic regurgitation, right? So now we're going to look at the location. It says it's at the apex of the heart, right? The apex is lower down. It is the mitral location, whereas the base of the heart is the aortic location, okay? So I would say think MA, mitral is at the apex, okay? And then you're going to think abs because AB, aortic, is at the base. But we'll get into all that, or check out the video because I know I'm telling you a lot, but I'm trying to help you process through these questions with the knowledge that you have. So, okay, again, we know it's diastolic, so mitral stenosis or aortic regurgitation. And at the apex, we know it has to be mitral, right? Because that's the mitral location. So your best answer is C, mitral stenosis, right? And also, I always say, y'all, there's so many mnemonics out to help you to retain the murmurs and walk you through it. Use whichever one sticks and works for you. I just create, all of my Britney's brilliance is based upon things that I say or do, and it's going to be crazy and different to help you retain it. So if it works, use it. But if not, use whichever one works. But don't try to listen to all of the things because then it's just going to get confusing. Okay, so whichever one you use to remember it, stick with it. All right, and lastly, question number 3. A 70-year-old male with a history of hypertension and smoking presents with shortness of breath and swollen ankles. On exam, you detect a high-pitched diastolic murmur, best heard at the apex, at the base of the heart. What is the most likely diagnosis? Is it A, mitral stenosis, B, aortic regurgitation, C, mitral regurg, or D, aortic stenosis? And I'm gonna read that one more time because I said apex, but it is best heard at the base. So it says on exam, you detect a high pitched diastolic murmur best heard at the base of the heart. Okay. So again, is it A, mitral stenosis, B, aortic regurgitation, C, mitral regurgitation, or D, aortic stenosis? Tell me what you think, y'all. All right. So again, first, is it diastolic or systolic? And it says diastolic, right? So it's going to either be mitral stenosis or aortic regurgitation, right? And then it's heard at the base of the heart. So it's going to be aortic, right? Because the aortic is at the base. Remember abs, AB, aortic at the base, right? So what do you have here? B as your best answer, okay? Aortic regurgitation, right? Because aortic regurg is a diastolic murmur. All right, y'all. So that's how I want you to process through anytime you run into murmur style questions to help you. Don't worry about all of the excess stuff. These details mean something and are helpful, but I'm trying, my thing is to teach you the easiest way to identify what you need to identify to successfully answer these questions and to understand it. And you'll also learn that when you are doing these things, that you'll be able to do this in practice and understand and identify it quickly and make quicker critical decisions. Okay. But as always, I hope you found this helpful. Please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. Everything that I offer is linked in the bio of this channel, including my website. And it includes a list. So if y'all go to the top, you'll be able to see it because I do get some questions on that. But I have the self-paced review that you are able to do independently. It's all virtual and online. I have my review books. You can either get it in paperback or the ebook option. They're both linked up there. My QBank options are linked up there. Digital flashcards are linked there. And I always tell y'all, if you're looking to book any of my one-on-one sessions, like my question analysis sessions with me, where we work through practice questions together, or the one-on-ones where we're just studying, or if you're preparing for board soon and you want to do a cram session with me, or if you are doing any of my custom packages or plans, typically utilized for people who have been unsuccessful before, so that I can give you my assessment. We do an initial assessment to gauge where you are. I structure a study plan, work alongside with you. We do one-on-one sessions weekly together, and then we do a post readiness assessment again after we have completed that. And that's my custom packages or plans. I always say either call, text, or email so that I can speak with you, so that I can gauge what you truly need to make sure what fits what you need at this time. You know what I mean? Because it could be tons of options available, and so many resources. And sometimes you just are, buying and doing different things. But I want to make sure that you're doing what is going to take you to success. So that's why I always say either call, text, or email so that we can gauge what you truly need to make sure you're booking the appropriate session. Okay. All right. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.